and welcome to another session of Health Talk with Dr. Aria. You are listening to Dr. Aria. So thank you for joining me, and thank you for everyone that has been tuning into our talks. We are still moving on with the topic on cervical cancer, and as promised, this week we are looking at the signs and symptoms of cervical cancer. Okay, what are the red flags or the warning signs that you should be looking out for that may be suggestive of cervical cancer? The first symptom or sign that you should look out for is any unusual vaginal bleeding. Okay, usually for women, every month we go through the menstrual cycle where we will have a period of bleeding. This may last for a day, up to 5 days, or sometimes even slightly longer. But normally we know when this happens for most of us, and this is a usual thing and a normal thing that happens. So any bleeding that is outside of your menstrual cycle, what we call intermenstrual bleeding, okay, is abnormal, and you should try and see your doctor about it. Also, any bleeding that happens during or after sexual intercourse is not normal, and you should see someone about it. And the other type of bleeding that is not normal is any bleeding after the menopause. That is another normal thing that women go through, that Dr. Ari will be dealing with in the future, the menopause, where women stop their menstrual cycle altogether. But it's a normal phenomenon that happens to women. So if you are a woman that has ceased your periods, so we say someone is post-menopause or menopausal if their period has ceased for a whole year continuously, so no periods for a full year and above that, that means that you're in the menopause. So any bleeding that starts after that period is abnormal and should be seen to. Obviously, apart from cervical cancer, this abnormal type of bleeding can also be related to other conditions. So it could actually be cancers of something else. So it could be like cancer affecting the lining of the womb. So it might not just be cervical cancer. So don't feel falsely reassured thinking, oh, maybe I just had my smear test not long ago and I was told that it was normal, because actually the symptoms that you're having can also be linked to other cancers as well, okay, if it's abnormal. So it's important you get it checked. So unusual vaginal bleeding, okay, is the first symptom. The next symptom or sign that you should watch out for is any abnormal vaginal discharge. Once again, it is normal for women to have some form of discharge. Often it is clear discharge, it might be white discharge, and this is something that you might notice most of the times, or even not always, but it is normal. So if you notice any offensive or sort of smelly discharge, that often is not a good sign. It doesn't always mean cancer. It could be an infection, it could be yeast infection, it could be a bacterial infection, but at least it is not normal, because infection itself is not normal, right? Even though it's not sinister, it can be treated. So the same way, if you notice any abnormal vaginal discharge, please do get it checked, okay? The other symptom that you should be aware of is pain between the hip bone, okay, the area between the hips. So we call it the pelvic area, yeah? So any pelvic pain, all right, you should get it attended to. Now sometimes, you know, people might feel pain in that area. It might even be just a sign of a urine infection. But having said that, you know, if you're having pain that is persistent, not getting better, you should get it checked, because it could be a sign of something sinister as cervical cancer. Then the other symptom that you should be aware of is what we call Dyspareunia, which is pain during sexual intercourse, okay? Normally, unless maybe there is infection which might cause irritation during sexual intercourse, or if there is dryness of the vagina which can cause discomfort. Once again, if you are having pain during sexual intercourse, it is an abnormal sign and that you should get it checked. So I hope this is useful for you. It's quite a short session on the signs and the symptoms or cervical cancer. So we are saying in summary, the symptoms that you should be watching out for: unusual vaginal bleeding, abnormal vaginal discharge, any pelvic pain, which is pain between the area between the hip, the two hips, okay, the hip bone area is an abnormal thing, and also finally pain on sexual intercourse. It is always important when you notice something that is different, that you're not sure about, that you always seek help. Seek timely help, because when it comes to cancer, actually it's all about picking up signs early, okay? And often the reason why people present late maybe is out of fear, or they're not sure of the symptoms, or they are worried. But that's the whole point. If you're worried, then get it checked instead of ignoring the symptoms, because if it's too late, then often when it's picked up, not a lot can be done about it, and often it feels like doctors have given up on you because there's nothing that can be done. And often it's not the case. It's because you presented too late, and there's only so much that can be done when it comes to cancer at the present time, okay? So early diagnosis, early detection would ensure possible chances or increased chances of cure. So don't ignore symptoms when you see it. So I hope this session has helped you. If you're a man listening to this, please do share it with the women, the wonderful women in your life, your sisters, your mothers, your aunties, or your female friends, so they can benefit from it. So next time we are going to be looking at cervical screening, and why it is important, women, that we do not ignore it, that we make sure we get our screening done. And then we will look a little bit at the HPV vaccine, okay, and its benefits. So thank you for listening to Dr. Ari again. Please feel free to share the videos, help someone. Even if you feel you have the knowledge already, then share that knowledge with someone, because knowledge is power, okay, and it can help someone a long way, and you could be helping to save someone's life. So thank you for tuning in. Until next time, you've been listening to Dr. Aria.